So, Dr. Mansi, good
Good evening,
evening.
ma'am.
Hi, hi.
Namaste. How are you?
So
Good
happy to
evening.
see you.
Namaste.
You look so
Namaste.
beautiful today.
Thank you so much. So do you.
Thank you. I got a mint leaf on my mouth. I've been drinking mint, fresh mint.
Yeah.
So,
That's good for your teeth, right?
yeah, real good for my
Mhm.
teeth. I got in my mouth.
But you,
I
you
like
want to cover your teeth, but
fresh mint. It can
oh
help
yeah,
with headaches and stress. You know, that and lemon balm.
It's
So
a
how do
stress
you?
reliever.
It is a stress reliever.
yes.
So what kind of good things would you like to discuss today?
So today I'll talk about sensitivity of teeth. Like, a lot of people complain of sensitivity to hot and cold beverages. So I'll talk about that today. So, we often get patients who complain of pain on drinking cold beverages or eating hot food. And they would like come and complain that, oh, we have this particular area. So that is what is sensitivity of teeth. So, any pain or discomfort to any external stimulus is sensitivity. This patients can have it either on a single tooth, several teeth, whole of your teeth. It can be anywhere. So today I'll discuss about all that and what causes sensitivity and what can be the treatments, few home remedies, and what are the in-office treatments.
So, so over to you, Dr. Mansi. Let's start the discussion.
Okay. So what is sensitivity basically? It is any pain that the patient complains of or discomfort because due to any external stimulus, usually hot and cold. Now this sensitivity is caused by a lot of factors. I'll just discuss a few in brief. Like first is when patients drink a lot of acidic beverages or have acidic foods like lemon or you have grapefruit and beverages include soda, especially patients who chew a lot of tobacco. They so what happens is the enamel that is covered, it wears off. Your teeth have three layers: enamel, that is the hardest substance of body, dentine, and pulp. Pulp is where your nerves are. So once this enamel wears off and dentine is exposed, is when you start getting sensitivity. You have dentinal tubules in your dentine that open up. So the pressure or the air changes at one end, they kind of disturb the dentinal fluid and then cause, transfer pain sensation on the other, and hence pulp senses it, and you have your stimulus and sensitivity. So, for coming back to the causes, first is mainly because of improper brushing. Sometimes we either brush too hard or use a very hard toothbrush. So we have to take care of the bristles that we use and the amount of pressure that we apply on the teeth. Some toothpaste are usually very abrasive in nature, especially toothpaste which have whitening gels in it are very abrasive. So whenever you start having sensitivity after using a toothpaste, say for about 3 to 4 months, start switching over to a regular toothpaste. The sensitivity might just revert back. The third cause of sensitivity is periodontal problem. Now, people with poor oral hygiene, what happens is they have these gum problems. Now, gums, they kind of protect your teeth. Once the gums start receding, they start going down, they expose the dentine on the root surface. And that's when the root sensitivity starts. This is also called as cervical sensitivity in dental terms. So this periodontal problem or your gum problem can be either because of faulty brushing, you are putting too much of pressure on the gum, or it can be due to poor oral hygiene. A lot of plaque accumulation has happened on its calculus. So these factors lead to sensitivity when the root is exposed. Thirdly, the enamel of the top surface of your tooth, it wears off because of bruxism. Bruxism is the grinding of teeth. It is quite commonly seen in patients whose occupation requires a lot of concentration. You know, when you're doing accounts or you're on computers or you're thinking too much, watching television, and you have your mouth closed, so you start grinding your teeth. Once you start, once you develop this habit of grinding teeth, this eventually wears off your enamel, and the dentine gets exposed, and the height of the tooth it gets reduced. Then sometimes using excess of mouthwash. Now, mouthwash is generally recommended, and a lot of people use it in a regular basis. But we have to be careful that these mouthwashes are not alcohol based. If you're using alcohol based on a regular basis, it's better to switch it over to a fluoride based mouthwash and see if the sensitivity reduces. Because you know what, the sensitivity of teeth, they you can actually control it with your daily regime at home. In case you do not, you are not able to control it, that's when you visit the dentist, and the dentist do some in-office treatment. So mouthwashes, you have to be careful that you either switch your mouthwash to a fluoride based, or you reduce the quantity, as in the duration that you are using. You can use it for 2 months and then stop it, or completely stop it. You know, you can just switch over to flossing your teeth and then brushing your teeth properly on a daily basis. Okay. The third point will be xerostomia. People who have decreased saliva are also prone for sensitivity. Now, such patients have to consult a dentist, and the dentist prescribes them some mouthwashes to increase saliva in their mouth. So, decreased saliva in the mouth also leads to sensitivity and erosion of enamel. If these things do not, the history is not into all this. Sometimes patients have medical problems like acidic reflux or esophageal regurgitation, or in layman term, acidity. If patient has a lot of acidity, has this problem of acidity or stomach problem, they have erosion or the abrasion of the enamel on the inner surface. So that's when you need to consult your dentist, who might refer you to a medical physician. Once you visit your dentist, he can also check if the sensitivity is because of some chipped tooth, like you're opening the cap of a bottle, or you have a habit of holding pen or pins in your between your teeth. So they all lead to chipped enamel, or your tooth can get cracked if you bite on something hard. This can also lead to sensitivity. Or sometimes old fillings. You know, there's decay around the old fillings, and that can lead to sensitivity. So at this point, you need to consult your dentist, who will take your history and who will examine you clinically, probably take x-rays and other radiographs to check the cause of sensitivity. People who chew tobacco have, over a period of time, the enamel gets eroded, and again, the dentine gets exposed, and you get sensitivity. So these are a few causes that lead to sensitivity on a very regular basis. That happens. You know, a lot of patients do this. So this is what it is. Now coming to the treatment modalities. Now, usually, I would say with experience, now these sensitivity can be controlled by changing your daily habits, and can be controlled at home. In case you are not able to control it at home, you can visit your dentist. At home, what you can do is stop your or reduce your intake of beverages that are acidic in nature, your foods that are acidic in nature, or soda intake, you're chewing your tobacco, you have to reduce all this. And anytime you take soda or any acidic beverage, please do not brush your teeth for at least 1 hour after. Now, why? Because you there is a agonist effect of acidic erosion on toothbrush abrasion. That is the reason you should avoid brushing your teeth at least for 1 hour after consumption of any acidic food or beverage. Um, then mouthwash, as I discussed, can be done. Maintaining your hygiene properly, brushing your teeth properly, so that there is no plaque accumulation. And you can also reduce the intake of your beverages and food. The second is using desensitizing toothpaste. Now, a lot of variety comes in the market where you have different compositions of desensitizing agents like stannous fluoride, potassium nitrate, or any other compound of potassium. You have sodium fluoride, you have sodium monofluorophosphate, calcium carbonate, any combination that is good. And the dentist advises. So you can use these desensitizing agents or toothpaste that come in the market. I usually recommend that you can either use it as a toothpaste or you can use a regular toothbrush and your soft toothbrush and a regular toothpaste for brushing your teeth. Once you are done with this, apply this desensitizing toothpaste like a cream over your teeth on all the surface of your teeth, especially in the area that is most sensitive. Just dry that area with the towel so that your tooth or the teeth, wherever you have to apply, is dry. And then taking small quantities, say about a pea size, and then you apply it nicely over that area. Leave it for some time, as long as possible. If it is just a tooth, you can just sleep over it. If it involves all your teeth, then you can leave it for 10 minutes, 15 minutes, how much ever time you want. And then just rinse with the regular water. And then do not drink any other water or food for the next half an hour. That's how a desensitizing toothpaste is usually recommended. Then salt water rinses. These are some home remedies that I have gathered over a period of time. Salt water rinses, warm salt water rinses really help. You just swish the solution in your mouth and spit it out. You can apply. India is famous for its Ayurvedic treatment. So you have turmeric. You can either apply turmeric on that tooth, or you can have a paste turmeric milk mixed with salt and mustard oil, and you can apply it. You can have green tea mouthwash at home. Green tea mixed in warm water, and then you can swish the solution in your mouth and then spit it out. You can apply vanilla extract on that, with a small cotton pellet. You can apply it on that affected area. Some people use clove oil also with cotton pellet. And, these are all home remedies that you can do. But the main thing is to use a desensitizing agent on the maintaining your oral hygiene properly. Now, in case the sensitivity still persists after you do all this, then you have to visit your dentist who will check you clinically and try to decide what is the cause of the sensitivity, and then treat you accordingly. Take X-rays, or you have like we dentists have a few methods for checking sensitivity, like the thermal stimulation, the electrical stimulation, the laser Doppler, the photography, and the radiographs. There are different procedures that can help us decide what is the cause of sensitivity. And then in office treatment, we usually apply varnish, or we have our own desensitizing agents or liquids that are applied in the office. And even after applying this, if the sensitivity does not go away, then dentist can evaluate whether the tooth has to go for a root canal or a capping or an inlay, onlay, bonding. Those treatment modalities are then decided by the dentist if the sensitivity still persists. Now, sometimes you have sensitivity after you have a filling. The patient goes back and calls up after 1 hour that have I still have sensitivity. Now, what happens is the tooth decay that causes your cavity irritates your cavity. Now, but we have to do the filling, which is also necessary. But unfortunately, it sometimes leads to more irritation, which over a period of time reduces. So the sensitivity will gradually reduce over a period of time, say in a week or two. As long every day the sensitivity diminishes, it is fine. But if the sensitivity still persists, like on biting, especially on biting or chewing of food, then you need to visit your dentist who might be check the bite, whether the filling that was done was a little high on bite, or was there any exposed surface left. So the dentist has to decide on that and then plan their treatment accordingly. Now, sensitivity also occurs after whitening of teeth. Now, whitening of teeth is in office or home, at home. At home, it over a period of time, if the patient uses a lot of whitening toothpaste, it erodes the enamel. It has that acidic effect on enamel and sensitivity results. So you have to apply those desensitizing gels that come with the kit. In office, lot of patients sometimes still have sensitivity after having acetaminophen or codeine or any anti-inflammatory drug. The pain or the sensitivity still persists post whitening. At that time, then we usually apply desensitizing gel, or nowadays the companies that come, they have less of these agents with the same effect, so you can use that. Or a low level red laser with the infrared diodes are really recommended these days. After a lot of studies that are being done, lasers have come into dentistry and are really picking up. The lasers do help in reducing the sensitivity. Now, once I had this patient who had bulimia. That's a condition that a lot of people follow. In this, you have to people who want to reduce weight or maintain weight, they kind of vomit out their food several times during the day. This really has a very bad effect on your teeth. It erodes the inner surface of your teeth. Sensitivity because of brushing or any external agents is usually restricted to your canines or your premolars and on the outer surface of these. But if you have sensitivity on your inner teeth, inner surface of your teeth, that means there is some kind of either stomach problem with acidic reflux, a lot of happening, or the patient might give you a history of bulimia. So that also needs to be considered while treating the sensitivity. Then, you basically, sensitivity can also happen because of dental fluorosis. Now, dental fluorosis is taking off excess of fluoride when the teeth are developing. That causes enamel hyperplasia. So this studies have shown that people with enamel hyperplasia also have an increased rate of sensitivity. So all this is considered while when we treat patients with sensitivity. Yes.
Yes, and so that was a wonderful conversation about sensitivity. I thought you were trying to discuss something else, so we take a pause basically in the meantime.
Well, I got so much out of that, Dr. Gupta, and I just wanted to say that it's a couple of things that you've told me that were the exact opposite of what I used to do, because I used to I thought putting more toothpaste on my toothbrush was good, and you've told us that just a little bit on the colored part, and so
1/3 to half, yes.
Yes, so I would put it, and then I would brush as hard. I thought the harder I brush, the better. And you just told us that that's not smart.
Not at all. That not only that causes a lot of harm on your teeth, and that's one of the major reasons for sensitivity of actually eroding the enamel. And you know what? Enamel, unfortunately, everything in the body can be rebuilt except for enamel.
Yeah, and the idea also that when I would go to the dentist, they would often tell me, don't drink anything hot or cold for a period of time after. And so that's because there would be increased sensitivity for whatever they were doing on my teeth. Is that correct? Because I would also feel that sensitivity after visiting the dentist.
Yes, sometimes once you have, you have got your filling done, the irritation stays inside the tooth, So that irritation is very natural, and it gradually reduces over a period of time, so a week or 2 weeks. If it does not, that's when you go back to the dentist again.
Now, my sensitivity has always decreased with time, so I've had that experience. The other thing that I wanted to ask you is about enamel. Is if you have eroded your enamel, is there a way to build it back up?
Sorry, unfortunately, no. The studies are still going on, but we have not reached that aspect when we can actually regrow the enamel back. We have only reached that aspect when we can block the dentinal tubules that become open once the enamel is eroded. The tooth has 3 layers: enamel, dentine, and then comes your nerve innervations or pulp. So once enamel wears off, there is no way you can grow the enamel back. You can only have agents that can block the dentinal tubules and probably form a protective layer over your dentine.
So it sounds, Ankit, like prevention again is better than the cure.
Yeah.
There's no cure.
That's what Dr. Rajat shared us yesterday, and that's what Dr. Mansi were trying to suggest. But Dr. Mansi, Dr. Rajat said that there's a lot of vitamin D is required, and we can take it from sunlight apart from taking a vitamin D pill. What is good for teeth? How we can make our teeth more stronger and more better for a longer period of time?
Like a vitamin or something? Is that what you're asking? Is there a vitamin we can take? That's
See, a lot of when you're growing up, calcium, phosphorus, vitamin D, all these are bone building factors. All vitamins and minerals are bone building factors, and that's what give you good teeth with there's strong adherence with the bone. But once you've reached the age of adulthood, you maintain this. The teeth you need to maintain your teeth. You need to have your calcium and your daily intake of all the vitamins. But with teeth, you need to maintain your oral hygiene for them to last long, to last like till 1995. You need to just maintain your oral hygiene. Normal flossing and then a good brush is all you need, trust me.
And I agree with you. When I was younger, they did was fluoride became a very important thing, and I noticed like in my family, some people have really good teeth and some don't. I don't know if it's an inherited DNA. That would be interesting to know. Where I was fortunate to have good teeth, I also had good disciplines because I never wanted bad teeth. And I know nobody wants bad teeth, but an interesting story I had where you say, just good practices, right? Is and we were talking about preventive. Is a young man I knew growing up said he didn't want to spend his money on dental care, because he thought it was a lot of money he really didn't need. But when he turned right at 50, around, 48, 50, he ended up having to spend a lot of money, tens of thousands of dollars to fix his teeth, even though he brushed them every day and probably flossed every day. There, I think, are certain things that a dentist will do for you that are early detection of problems for something that can spread. And I don't know about fluoride treatments, but I want to ask you about that. What is your opinion on fluoride, like taking the pills or treatments?
So taking the pills, I wouldn't really recommend, but you have fluoride gel that can be applied on the teeth. So fluoride has two main effects. It forms this protective layer on your teeth that reduces the occurrence of cavity, especially in children. We recommend a fluoride application every once a year for this very own purpose, so that there is less of cavity. And secondly, it blocks the dentinal tubules in adults. So people who have exposed dentine, or the enamel has worn off, in those cases, it forms a very thin protective layer that reduces sensitivity to a certain extent.
Okay.
So that's fluoride gels are recommended, or a mouthwash. A good mouthwash with excess of fluoride. Sorry, yes.
I wanted to follow up on what Kimberly was saying about DNA, because the Irish always think that they have bad teeth. Is it possible that they are born with less enamel?
So genetics plays a factor in every aspect of life. How pretty you look, or what is the color of your skin, your height, whether you're fat or you're genetically thin. So genetics is one thing that plays a role in every part of your body in some way or the other. Sometimes it can be more, it can be less, but it plays an important role in every aspect of your body.
Yes, but I was thinking,
including teeth.
Has there been any studies that say one ethnic group has stronger enamel than another ethnic group, or something like that?
Lot of studies have been conducted over various populations. So people who have darker skin are considered to have stronger teeth. Yes. But the color of their teeth or the enamel is more yellowish. So the skin, those studies are really conducted, and every study gives you a very different perspective and conclusion.
But I think Dr. Mansi would be agree that people who take more sugar, they have tendency to have a bad teeth, or maybe something which stick into their teeth. That's what you suggested last time as well.
Definitely. Sugars have a very bad effect on your teeth, no doubt about it. Especially sugars like chewing gums or taking sweeteners, they have very bad effect on the teeth. They not only cause cavities, but they also erode enamel. Breath mints. People really take breath mints, and these breath mints have this acid effect on your enamel. So sugars, you should avoid sugars and reduce the intake basically.
So Jim,
and whenever
yes, Dr. Mansi.
So whenever you have this acidic beverage or sugar, just to neutralize the effect, have water. Just drink a glass of water, or just to neutralize the effect. I would not say start having more of sugars or acidic beverages, but this is something that is a little offhand, yes.
How about an apple a day?
Keep handsome doctors away, yes.
The drink water, an apple a day. Yeah. But you're not telling me if I can tan my skin instead of burning it, I can tan my skin, my teeth would get better?
No, I'm not saying that. You have to get your DNA changed for that.
Yeah, that's right.
But we have got to understand that as you asking about Irish thing, so you need to understand what is the lifestyle about the Irish people. If they intake more sugar, that's why they have a bad teeth as compared to other.
Yes.
So history all that Irish cream.
Irish spring,
Irish coffee, and maybe an Irish ice cream would carry that teeth.
Irish cream, Irish coffee. There's just so many. It could just be, the beer, right? There's a lot of sugar in beer, and
Oh,
a lot of people
no.
don't know that.
Killing me.
So that's all sugar, sweet poison that we take, right?
Right. It's also
Dr. Mansi,
probably.
also, you know that in India, people used to take a lot of neem for cleaning their teeth. So what is
Neem.
neem, yeah.
Yes.
You remember
So
that
neem,
and also?
yes, that one, yes. I
Yeah,
still recommend that. Oh, yes. Neem has a very good effect. So that in India, a lot of Ayurvedic treatment is done for teeth with neem, with clove. Like people are asked to eat on chew on garlic,
Oh, yeah.
and use turmeric.
Turmeric.
The Ayurvedic treatment uses turmeric or coconut oil. Ayurveda says that oil pulling is a very effective way. So coconut oil, yeah. Sesame oil or coconut oil, you use it like a mouthwash. Swish it in your mouth for 2 seconds and then you spit it out. So that
Wow.
is oil pulling. Yeah.
So
I
Dr.
use
Mansi,
coconut oil on my hair and on
how
my skin. I never thought about my teeth and gums. That's
Me either.
It has the same effect. The coconut oil has the same effect in the
yeah.
You can use it as a mouthwash. Yes.
I also want to share with people something I learned because of you, Dr. Mansi. I didn't know what that blue spot was for my toothbrush. All of these years, I had no idea what that blue thing was.
So
And
that's
I guess I never did read the fine print, or it never showed you. It never showed you just to put your toothpaste there, but you did.
Thank you.
And I
Thank
kid you
you.
not, ever since then,
Thank you.
I put my toothpaste on the blue dot.
Absolutely.
Thank you.
So
Yes.
And also we have started rotating the teeth up and down because no one knows about it. We were doing left and right earlier.
Absolutely.
and
That's the way I grew up.
yeah, but I've always brushed my gums, so I think that's why my gums are so good. My doctor said, she always says for your age. I hate that, but
So Dr.
Even
Mansi,
after brushing, you can massage your gums with your fingertips. That's a tip that I'm just giving you. That once you've finished your brushing, just massage your gums with fingertips round and round for a minute, and it increases the blood circulation and keeps the gums healthy.
You remember the little finger brushes they had that had like a little bit of mint and something on them? So they were like little mints that you put on your finger. And I just realized that would be perfect. I used to carry a pack of them in my purse, and I would brush my teeth if I was on the run and didn't have so. But I carry a toothbrush with me everywhere I go anyway. But I'm going to I wonder if they still sell those little finger mitts that you can do that with. That's a good idea.
Yes.
It had mint on it and it tasted really good. So
Yes, those are finger brushes. Yes.
Gupta, you're telling me that I can't just blame my genetics. I can't blame my genetics because it's also been my bad behavior.
But yes, but you can maintain it with your daily regime. Why blame genetics?
So it's
Blame genetics for the good
temper.
part.
and we have Mr. Ramesh Jain joining us from Delhi. Good evening, sir. How are you doing?
Ramesh.
Hello. Hello, Ramesh.
Hello.
Hello.
Namaste, sir. How are you?
Namaste. How are you?
Namaste. Good evening. Welcome to our Saturday morning and evening spiritual talk, but also good dental hygiene, which I think we need all the time to hear these little tips. And even if sometimes it's repetitive, I think it's good to hear these things because you can't do enough to protect your teeth. I think it's one of the best things you could do is preventive care. After the story that someone shared with me about how they didn't feel like the need to invest in their dental care their whole life, and then when they, around 47, they had to spend tens of thousands. So all the money they would have spent a little bit over time, they kind of paid all at once, if not more, with interest to fix their teeth. And there's nothing. My dad always said there's nothing like having your own real teeth, right?
Nothing like it. I also agree. Nothing like our own natural teeth.
Yeah. So,
And Dr. Mansi, I mean, we have seen a lot of advertisements about dental toothpaste and brushes and all those things, and they talk about salt is a very good part to have in your teeth. So, where do you rate salt while doing the brushing or making sure the teeth looks white and clear?
Rinse with salt
Pardon?
water.
Can you repeat the question again?
So, I said they said salt is very important part to make sure your teeth remains healthy and white. So, where do you rate salt in your brushing?
with salt.
So salt. Okay, so salt, has healing properties in it. Yes, we all know that.
Yeah.
So some toothpaste already have salt in it, so you don't need to have that added salt.
Okay.
Otherwise you can have salt water rinses. In
Right.
warm water, you just add about a teaspoon of salt, and then you swish that solution in your mouth. Or, as Ayurveda in India says, you can mix the salt with mustard oil and then rub it against your gums in a circular motion. That keeps your gums healthy. On teeth, I usually don't recommend applying salt directly because it is usually added in your toothpaste. If your toothpaste is of a good company, it is already added. So you don't need extra salt on your teeth. But for gums, you can have added salt, yes.
And
Wow.
Dr. Mansi, would you suggest to have a custom toothbrush for everyone because toothbrushes are generally available and people just buy anything and then they just start using it? So it should be subscribed or prescribed by a dentist to have a toothbrush and then they can carry for 3 months and then they can change it and get it other one.
So the toothbrushes already come in various sizes, various shapes. For the kids, they have different. So it all depends. You can ask your dentist what kind of a toothbrush and with bristles you require. Some require soft bristles toothbrush with a small head. Some require medium bristle toothbrush with a medium head. So I think already a lot of variety comes in the market, and you can just ask your dentist which one is recommended as per your jaw size.
But the problem is people like us, we don't know which one is good for my teeth.
Oh,
So in general, okay. So in general, if you know that you're not applying too much of pressure on your teeth, you can go for medium bristles. But if you feel that your teeth are already very sensitive and thinned out or worn out, go for soft bristles. And the head of the toothbrush should be either too small enough or big enough to reach your last tooth. When you're buying it, you have to make sure that the head of the toothbrush reaches the last tooth of your teeth. So usually small to medium toothbrush is recommended. And for children, we have different types. You have age specific, like 5 to 7 years in the market. So those are good for children.
And you want to get to the gums in the very back of your teeth too. It seems to me.
Yes.
That's one of the things that actually helped improve my dental hygiene.
Yes, it has to reach the last tooth, the last point of your last tooth.
But as far as what should I use for myself, I just watch the commercials and they say 9 out of 10 dentists recommend this, so I'm sold.
That's a good selling gimmick.
I have a question. In the U.S., we have a thing called the tooth fairy, and the parents collect the baby teeth, right?
Yes.
I think I found some baby teeth in my mom's jewelry box that she kept as kids, and I kept my son's baby teeth. Is that a common practice in India? Do y'all do this?
Oh yes. I have. Yes, I practice it with my own children. So they're so excited about the tooth fairy, and they write a letter to the tooth fairy what all they want, and they're excited. It's fun.
It is fun. And
it's like Santa Claus for them.
Started losing her teeth yet? She has. Fairy.
I was very
with teeth, we have lot of rituals and lot of there are a lot of things involved, and we call akal jad, and then we put it in a mud and things like that. So, do believe in all those rituals?
No. I don't believe in all those rituals. I'm a little scientific that way.
That's
But tooth fairy is something for kids to make
I
them
think it's
smile when the
beautiful.
tooth falls off. It's basically for that. So that is something different. But otherwise, it's like getting stuck into a mud pit if you start believing in all these rituals.
Right.
Like
I just think it's
people,
cute.
when they come and they say, if you extract my tooth, I'll go blind, or something will happen to my wisdom. Especially if you take out the wisdom tooth,
Yeah, you
we'll suddenly become less wise.
I don't feel the same.
No, not at all. So these are all myths.
Yes.
but yeah,
And there is one more fact about brushing is that a person spend around 100 days of his life just doing the brushing.
Yes.
Wow.
That's a
That's a
fact. Yes, that's a fact.
That's a good
Those are some
investment, though.
interesting dental facts. Yes.
Right, that's a good investment. Something I noticed about the baby teeth is they don't really rot after they come out of the mouth and you store them. They don't really decay much, do they?
No, they don't. Even adult teeth, they don't.
Right.
You can
Interesting.
keep them. You can keep them. That's what dental forensic is all about. You can actually gauge the age of a person by just calculating the tooth. There are various parameters to gauge the age of the tooth, and then you can decide on the age of the person.
Yeah, it's like
That
rings
is
on a tree.
forensic odontology. Yes.
Yeah, it's like rings on a tree. We judge the age of a tree by the rings on it, and it's the same thing when people look at
Yes,
even my
with
pet.
the teeth. Yes.
When I adopt a pet, the veterinarian will look at its teeth to tell me how old it is.
Yes.
Yeah, you're
Yes.
right about that. I've seen that.
They don't.
So, absolutely. That's interesting to me, how teeth are, and just a little bit of respect every day for your teeth can go a long way.
And it goes a long way. Yes.
So
But when you age, do your gums naturally recede, causing more problems or exposure to your nerves? Does that happen, or is it just that you're not taking care of them well enough?
So studies have shown that once you reach adulthood, say about I would say around 40. So there's a natural process of receding gums or your enamel getting lost. That's a natural process which you can't stop. But it is so slow. It is so slow that you can delay that process by just maintaining your oral hygiene every day.
Yes. Okay.
Yes.
And
So,
if it starts at 40, I don't have to worry yet.
True.
I've
Very
learned so
true.
much from you, though. I'm really grateful that you've been willing to come on and share all of these little details, because I think I have found from experience just gargling with salt water helps with my sensitivity. And so the things that you're sharing have also been confirmed by my own experience, but also some of the things that I have done are counterproductive based on what you're telling me. And so I need to change my behavior in order to keep better care of my teeth.
Thank you. Thank you.
No, I think this has been a truly wonderful, morning of learning about what we can do to better protect probably one of the most valuable assets in our body, right? My doctors used to always tell me what happens in your mouth can also help detect heart disease, cancers. You just have to stay on top of it. And
Yes.
I just spoke with a friend of mine this morning who actually went in to have the COVID test. And again, that test is done in your mouth, right? Well, back in the throat. So again, you want to keep your mouth clean, rinsing, I think, every day. Even 2 or 3 times a day can't be bad. But, constant good cleaning and rinsing might even help. We can't say it will prevent, but it could help prevent COVID if it got in your mouth. So,
I have one thing. When your children lose their baby teeth, if Sasha was on, he would tell you to not give them money, but to invest it in gold.
Can Can you have fillings in gold? That's what I want to know. So, here's a gold nugget for every tooth you lose. There you go. I like that.
But nowadays, I've seen a lot of people doing tattoo on the teeth.
Yes, tattoo, and you have these diamond studs. You know,
The diamond
what we
stud,
call.
yeah.
Yes, that you so you have all those things. You have people have started coloring their shading their tooth to give it a good smile.
That
Yes,
hurts
those are,
to
yes.
think about. A little girl that used to ride horses with my son. She, her dad was from Arabia, and she went back home to be with him. And when she came back, she had a diamond stud in her tooth. I'm like, you did that on purpose? It's just, it's about status for them to.
Well, what does it do to your tooth to have a diamond?
That's what I want to know.
That stud, it is just fashion. It's fashion for the young girls.
How do they get it on there? I didn't ask her. Do they just glue it, or?
So you have special glue. In a layman term, it is called a glue, but only a dentist can use it. And you just glue it, and you can enjoy it for 6 months to 9 months. And then when you're tired of it, you just go back to your dentist, and the dentist deglues it.
Can you swallow it?
Yes, chances are high. But if it is done properly, no.
But Kim, you know that.
Swallow my diamond.
But it's only for those who have so much of amount of money they don't know where to put, so they put it on the teeth.
They put it on the teeth.
No. You know, see, diamonds are forever. These are for your 6-9 months fashion statement.
Yeah. But that's the whole thing behind bling, too.
I would feel weird having something in my mouth that long. I remember when I had stitches from when they had to remove my teeth, and they had to do some surgery in the roof of my mouth. They had to remove a tooth, and I had a stitch hanging out, right? That drove me freaking crazy.
Sure.
I could not imagine a diamond on my tooth. Just weird. But these are all, things that people do that are interesting to me. Why your teeth? I don't know. But tattooing a tooth. I mean, tattoo the tooth, or is it the gum?
What?
It's the tooth, I think.
Do they tattoo
the tattoo?
Yeah.
No, only the tooth, not on the gum.
How do they tattoo? Do they drill into the tooth? Or
no, they have those special paints, like how you have a tattoo on your skin. So they have these special paints that you can use it on your tooth. I wouldn't advise drilling on the tooth and then getting paint on them.
I prefer getting little art. I don't even like to get my nails painted.
Like you have nail art.
Paint on my nail.
Yeah.
And Dr. Mansi, one of our viewers from Australia would like to know that is charcoal is something which is good for brushing or cleaning your teeth?
So you know what? There's a controversy in studies. One study says that charcoal is good for your teeth, but the other study says that it is acidic in nature also. So now you have toothpaste also coming with a little bit amount of charcoal in it. So it's a little controversial study that I would really not get into.
Wow.
Because some say it is good, and some say if used over a period of time on a regular basis in a definite amount of quantity, it can have a wrong effect on your enamel. It can actually erode your enamel.
I read on the internet that it was good. So
yes, so that's why a lot of toothpaste have had a small amount of charcoal quantity in their paste.
Okay. But Dr. Mansi, what about chocolates? Because Kim would like to know that is chocolate good for teeth?
My wife wants to know.
The dark chocolates are always good for your health. You can have dark chocolates. Yes.
One of my sister-in-laws she's fighting cancer a second time, and this time the treatments have made her very, very sick, right? And she can't eat anything but dark chocolate.
Dark chocolate
that's been her favorite thing her whole life, right? But she says, I can't eat anything but dark chocolate. Yeah, she's 80.
That chocolate I put, but in limited amount.
Yeah.
And try to have water once after eating chocolate. Try to just have a glass of water to neutralize the effect.
Yes, and that's something that I learned the hard way, because I would have ill effects from just eating dark chocolate, and I found out that by drinking water afterwards, I did not. So
Yeah.
I think that's really interesting. I couldn't figure out why, but I knew it did work.
It does. It neutralizes the pH level actually in your
Wow.
mouth.
Well,
I
that makes
didn't know that. That's interesting. That's very, very interesting to learn this. It's just, I think we take for granted every day our teeth. We, do good things for our eyes. Of course, if you can't see, you're going to go get glasses and you're going to maintain your eyes. And we try to maintain our hearing, but people don't realize, your mouth and your teeth is what nourishes you, right? And we've really got to put that effort, just a little bit of maintenance. That's,
Right.
again, I just, this year learned a little bit of toothpaste goes a long way.
Long way.
To this day, I'm putting it on. I'm not going to say how old I am, but I'm way over 50. And every day now I'm putting it on there going, I had no idea. I could have been saving a lot of toothpaste all of these years.
Well, I always thought the more the better. If I put more toothpaste on, it had to be better.
Yes, I know.
Yeah,
so
because it causes more froth in your mouth and it gives you that good taste, and you feel that you're really brushing that too much of froth is not good.
Yeah. So is mint really good for your teeth? Because I eat it all the time off of my back porch. I have a big mint bush, and I'm always chewing on it. Is it okay?
So instead of chewing on mint, have mint water.
Oh yeah, I do that too. I put it in my water. So
yes, you can have that, and you can sip on water instead of chewing directly neem leaves or tulsi or mint leaves. They have that acidic effect on your teeth. So once you put it in water and sip on that water, that's when it is more healthy.
Okay.
What about basil leaves?
Basil.
Basil, they're all healthy leaves. They're all healthy leaves that you can either put it in your food or in your water, and they have that overall effect on your whole body, including your teeth and your gums.
We had another doctor tell us that turmeric, coconut oil, and he also mentioned basil leaves. So
yes, basil leaves, guava leaves. Ayurveda says that if you chew on guava leaves, you will have less sensitivity over a period of time. Or on garlic, you can chew on garlic. So these home remedies, they do help over a period of time.
And are you talking basically about boosting your immune system? It's not teeth specific; it's whole body specific.
Yes. Having turmeric in milk, it boosts your entire immune system. It's the best antibiotic at home.
Yes, I do that every day now, because we had on a guest on Sasha's show, we had a guest who had suffered from COVID, and the doctors weren't helping her. And she found this, what she called golden milk, which was turmeric and milk. And she said it helped her almost immediately.
Kid's been promoting it since the first show. So.
I've been drinking it every day now. Since
my turmeric latte is about to ready. I will be having it in
turmeric lab. Okay, there you go. Manufacturing turmeric as we speak.
And it's very easy to have it. I mean, you have turmeric powder and you have a turmeric which you can just grind it and put it in water, and then just put some soothing for you can grind it with a mixture or something like that. If you want
black pepper.
Not black pepper and turmeric. Black pepper can be consumed in some way or the other, but not with turmeric.
Some other way. Huh.
Yeah.
If you milk, you just add turmeric.
Yeah.
Really?
Yes. Otherwise, I don't know. We call kada in India. So you have that in water in a very different way. You can add black pepper and turmeric and tulsi leaves and a little bit of honey in water, and then you boil that water and then drink that. That is for your immune
it's like a
system.
spice water. It's like a spice
Yeah.
water which we boil with a lot of spices and then have it. It's good for your tongue and everything. Basically, it's an immunity booster. And in
For
India,
your
I
whole
believe
immunity.
50% of Indians are having kada since 3 months.
Yeah, it's so true. So true. People have started manufacturing that,
Yeah. I know this. Yeah, people started.
Yeah.
And do
You
you
know,
drink it hot?
Jim, we consume water in an earth pot basically.
Earthen pot.
And that's also having growing since the COVID happened because no one wants to drink
Copper.
that. Copper as well. Yeah.
Copper utensils have really picked up now. Yeah.
I'll tell you what's interesting is turmeric's been around a long time, right? And it's not in my book. I don't understand.
Because we have a turmeric patent in India. That's why we didn't share it in your book.
It's
They're keeping secrets from you. Don't get on Kimberly's wrong
best
side.
hidden secrets are not in this book. Now we know. All right, who wrote this
It's time to
book?
rewrite the book.
Talk to
Kim,
them.
it's time to rewrite the book.
It's time to rewrite my favorite book. As you notice, there's a few books I pull down. This is one of my favorites because it's easily explains every plant, right? And then it tells you how to make the medicinal purpose out of it. So, like if you need to steam it or dry it, but it tells you, and it's very short and simple. You know, propagating, how to propagate them. So it's probably to me one of the best herb planting books ever written. But no turmeric.
No.
What else are you hiding from us?
Yes. Oh, there's so many secrets.
For that, you have to visit India. So likewise, when we say Vasudev Kutumbakam, we have one more phrase which is like Atiti Devo Bhava. So we welcome all our guests to join and come India and then see our culture and enjoy the culture.
So we have Ramesh. Did Dr. Mansi leave? So I didn't get to say goodbye.
I think there might be some bandwidth issue because
I think
Ramesh has been here for a while. Let's talk to Ramesh. Hi, Ramesh.
Welcome back.
How are you doing today?
I'm doing well. Good morning to everyone.
Good.
And I must congratulate IBM TV for this wonderful show.
Thank you.
The awareness that is given to all of us is really very welcome, and I hope that you will continue doing such programs in future.
Well, we will, as long as wonderful people like you keep joining us.
No, it is really very, very awakening and very knowledgeable. Very knowledgeable.
Well, so, can you tell our viewers what do you do? Where are you from?
Well, I am from Delhi. I am an engineer, and I am 73, but I am working. I have a small factory of my own, making precision tools. So.
Making precision tools. Wow.
Yes,
Explain to us a little bit about that.
Very fine tools. I invite you to visit our works sometime if you happen to come to India. Thank you so much, and once again, good luck. Please keep it on.
Thank you so much. Yes.
Thank you.
Thank you.
There's Rakesh. Hi, Rakesh.
Bye, Dr. Mansi.
Good evening.
Namaste.
Bye.
Namaste. Namaste. What's going on in Hong Kong today? I haven't been able to speak with anyone all week. So how are you doing?
Please stay healthy during this difficult period.
Yes.
Sure. Thank you.
Stay safe.
Thank you.
Stay safe.
Thank you so much.
Thank you.
Bye. Bye. Bye.
Bye-bye. Yeah, Hong Kong's had some new cases. Yesterday, some 3 new cases, but otherwise, no major change. Business is booming. We're okay. Everybody wears a mask, so I think that is the key factor.
I have to agree with you. And Dr. Arthur has asked that we can.
Before we start with Rakesh, I think Dr. Mansi needs to leave.
Okay, Dr. Mansi, thank you so much for visiting here.
I smile at you.
Thanks for joining us, and we are looking forward to see you next Saturday.
Yeah.
Sure, definitely.
Goes a
Yes.
long way.
Good.
Thank you.
Bye.
Thank you.
Bye-bye.
Okay, bye. Stay safe.